Good afternoon, ladies and gentlemen, participants. Good afternoon, Luciano Huck. It is a pleasure and an honor to have you with us in the closing session of our event on innovation and healthcare. It's called the Colmeia or Beehive. We had over 120 speakers and panelists from Brazil and from 9 countries participating, over 15,000 people participating actively in this live event on innovation. We have the pleasure of welcoming this great Brazilian who is Luciano Huck. He's a very interesting guy, you know, because he's successful, he has a beautiful family, wonderful children, he is attractive, he is desired by all Brazilians. They want him as a brother, as a son, as a father, as a friend, everything. And even so, Luciano Huck is a social entrepreneur. He participates actively in the country's political life. He tries to discuss all the problems we have here. And receiving Luciano Huck in the closing session of our event is like a golden closing to these 4 days of such interesting discussions with wonderful, intelligent people who gave us this opportunity. And I thank my friend Margaret Dalcomo, my friend, a brilliant physician, an example as a citizen, to have facilitated this contact with Luciano. And before giving him the floor and having our conversation, I would like to comment on this dramatic situation that we are experiencing in Brazil and in the world with the pandemic. And I want to thank all of those who have contributed to social distancing by staying at home, by wearing masks, by washing hands. People have been making a joint effort to preserve lives. People who go out to the streets in agglomerations, denying the situation, they don't matter, you know, compared to this much greater contribution, effort, and sacrifice that is being made by most of the Brazilian population. And I want to honor the people who made the effort of staying home by paying homage to a great person who unfortunately left us yesterday, Paulo Gustavo, a wonderful human being who faced so many difficulties in his personal life, but always with joy, with enthusiasm, and he made an example of his own life. I watched so many times his play, Minha Mãe é uma Peça, when he honored a mother called Emília. Emília represents all mothers in Brazil who are now protecting their children, who are keeping them home, and who are obeying the sanitary rules that we need to follow in order to overcome this difficult situation until we finally get vaccinated. So I want to thank all of those who have been working hard during the pandemic, people who work with delivery, city workers, people who work in grocery stores, supermarkets, public transport, all the people who face this difficult situation because it is their professional duty and to contribute to those who want life, who want to live. But those who go to the beach, who go party, do not deserve our honor. And on behalf of all of us, I would like to thank for everything that Paulo Gustavo did to bring us the joy of living. And I am certain that wherever he is doing something funny to make our lives less sad in these sad moments. So thank you, Luciano Huck. Thank you very much for being with us. Thank you, Mr. Josier, for the invitation. Thank you to the organizers of the event. I believe that discussing public health today is so important. We need to value what we do right, minimize our mistakes. I want to thank Dr. Dalcomo for helping me to be here. I respect her enormously. I met her and have been exchanging ideas with her since the beginning of the pandemic. She has a wonderful way of explaining complex things in a simple manner for lay people in healthcare. And it was very helpful to hear her communicating, and her work was exhaustive and very important to bring information to the public. You mentioned Paulo Gustavo. I, of course, also cherish him greatly, a very close and dear friend. To me, individually, it is a great loss. He was so talented, so intense and fast. That is why some of his plays, critiques said that he was hyperactive because everything was done in an enormous speed by him with so much closeness to his family and friends. He brought down walls with regards to bias and discrimination, and a wonderful comedian, one of the greatest talents in Brazilian comedy. Whatever he touched became a success because of his wonderful capacity of making jokes out of everything. But more than that, I believe we must emphasize in this event in which we are talking to the medical community is my anger, my disappointment at seeing one more life lost, a person with a young family, 2 young children to bring up. And now we feel that over 400,000 Brazilian families have lost their dear ones without being able to bury them properly, without mourning for them properly, without being together, hugging their families over their loss. And all that because of the lack of competence in our sanitation measures or lack of measures. Brazil, in the United States, in 3 months, they reversed the situation. Paulo Gustavo, he worked in theaters. Now the Broadway theaters have announced that in very short they will be able to reopen and fill their rooms again. And on the other hand, we are here continuing to see people lose their lives, and we have no hope. And I saw my children crying together. They got together with their friends virtually to watch his shows and his films, and you have the pandemic, and he is a myth. But here we have biblical numbers involved in the number of deaths. Paulo Gustavo said in his last work at Globo that laughing is a part of resisting and enduring. And I hope that people are missing him. Yesterday night, there was a wonderful homage. People clapped hands outside their windows all over the cities in Brazil. So it shows us that this disease can kill people, any kind of people, famous people, not famous people. And Paulo Gustavo is part of the loss of the joy of the Brazilian people. Such a happy and joyous people who know how to enjoy life. And knowing that Paulo will not see his children grow up. He would have been vaccinated already if this were a serious country and if this country had treated the pandemic correctly and properly. So it was a tragedy for those who loved Paulo Gustavo as I do. I'm sorry I spoke too much, but I had to put out these bottled feelings. I'm very happy to hear you because you represent the feeling of what the Brazilian people feel, and we can hear that and feel it in your voice. Paulo will be missed, and even more, we will miss what was not done to prevent his death. We have over 400,000 deaths, and many of these patients would be alive if the attitude towards the pandemic had been different here in the country. I have no doubt about that, and I am speaking as a physician. One of the biggest problems we had during the pandemic, in my view, was the wrongful communication, misinformation, wrong signals, people saying one thing on one side, another thing on the other side. And it's natural for human beings, if you hear a message saying that if you drink coffee every day, you will not catch COVID, of course you'll take 10 cups of coffee every day. If somebody tells me there's a drug that I can take and I will not catch the disease, then I take that drug and I go out in the street and I do everything wrong because it was miscommunicated. You are a great mass communicator, Luciano. Brazil has so many inequalities. You know Brazil as a whole. I know that you travel around the country for your shows and you know the reality in Brazil. So I think that we are very much similar, especially with regards to institutional education. As a communicator, how do you think we could build efficient communication that would reach out to all social layers in our country in an effective and efficient manner to avoid that all these bad things from happening, these agents of evil who have hurt and damaged society all over the world, and much more so here in Brazil. What would you suggest as a social communicator for us to build a form of communication that would reach people correctly?
Well, Mr. Vilar, we started talking about Paulo Gustavo, and I just thought of him. But I actually wanted to be at this event for you, because for you to be able to talk about healthcare professionals is a privilege today. As Brazilian, as father, as son, I am very grateful to healthcare professionals in Brazil, because if it weren't for our public health system, our healthcare professionals, our situation would be even more catastrophic. On behalf of the Brazilian people, I'd like to thank this event from the bottom of my heart, the courage, the drive, and the effort of all healthcare professionals in Brazil. I think that was the best way of communicating something when you talk about public health is education. There's no other ways. When the child understands at school, 7, 8, 9 years of age, what a virus is, how it multiplies, how it contaminates, what's a bacteria, how it multiplies, etc., the importance of your caring for your health, the child alone will wash his or her hand. You don't need a school monitor or somebody actually forcing the child to wash their hands. This is a cultural and educational thing. Once we have public education with quality, and for that, we don't need to put any additional bricks. We have 15 million students in school. We have 200 million schools. We have a community of 2 million teachers. But we need to value teachers, qualify education, bring education, looking into the future, to the needs and demands of the present times, and not of school today, a medical event. If we froze a surgery room 200 years ago, and we froze a classroom 200 years ago, when we defrost them, the surgery room, the doctors wouldn't even know where they were. The amount of devices, technology there, they would think they are in space. If you defrost a classroom from 200 years ago, it will be very similar. So we need to value our teachers, modernize our education, transform education into state priority. It should be a state project, not government project, that it can go beyond the project, regardless of who's leading the country. That should be a priority for the country. When this actually happens, and when school of the poor boy is the same school of the rich boy, I'm not talking about huge swimming pools and flat screen, the quality of learning, engagement of teachers being valued. When both are the same, we end this zip code luxury, because depending on where you live, you will have this type of education or that. And then when we end that, then only then will we be talking about a society that can address prevention in public health in a much more organic way than we have today. I think it's worth talking about, when we talk about public health in Brazil, for me, the greatest successful and relevant public policy since the public health system was implemented in 1978, the public policy, health policy is being tested at maximum stress during the pandemic, and it worked. Luciano, this is quite interesting. You know that you're urging for education. You know I'm your fan. I mentioned it before we started. I am Luciano's fan. I've been his fan since the time when I watched his show on a Saturday afternoon, and Huck's Cauldron, and it was the spelling bee, soletrando. And I was really impressed because, well, I had somebody who had it on, and so I thought it was great. It were public, private schools. I can't remember whether they were private schools or just private or just public. It doesn't matter. So there were children in a contest on the Portuguese language. Well, go ahead. And then Luciano would say a difficult word, and the little boy would spell the word. And that was an encouragement to education. And I think this DNA of yours to encourage education must have come, obviously. I had a look at your background before we talked. I know you've been an entrepreneur since you were 20, when you set up opened a bar in Sao Paulo with some friends, and you actually had this entrepreneurship viewpoint, and the viewpoint of entrepreneurship has actually been cultivated because you've had access to education. You were able to organize mentally your thoughts and your wishes. And I think that the good communication for the Brazilian population goes through the education of the population so that the population is able to correctly interpret things that are said. And then, Luciano, congratulating you on this enthusiasm that I share, I'd like to know from you the following. This epidemic or pandemic in the world, epidemic, but it's a world pandemic, what do you think was the great lesson learned that this pandemic is leaving for the Brazilian nation? What, in your viewpoint of an active player in society, an observer of customs, what do you think that we will have inherited? What's the legacy that will have been left by the pandemic to the Brazilian society? Where can we implement things that with the future coping with new epidemics that science affirms that we're going to have others, but we just don't know the date. It's not far away. So what do we have of learning? What do you think is actually being taught by this pandemic to us? First, I think it's very difficult for you to try to think about something positive amidst the biblical tragedy that we are living in Brazil. I cannot think about numbers without thinking about the families, the number of deaths that we see going up in the news, and not think that there is a chair, fewer at the table, somebody that loved somebody else without grieving, without mourning, and without being able to bury. And I think the scar will last for a long time. It hurt deeply. We can get to the end of the year with 600,000 deaths. It's one of the largest cities in Brazil. It's dominating a whole city. So this is very, very hard. So I see 3 points. As you were speaking, I took note of 3 things. First thing that comes to mind is if we manage to get out of this crisis, I think it's at least a positive point. Brazil historically donated. We donated to our GDP. So billions, well, we have a Pentecostal churches pre-pandemic. It's this first month we donated threefold what we donated in a year. And this is very important. So the government not only mitigating the impact of health, but also the economic impact that affected everyone's lives, in addition to families that were supported by the emergency aid, but also entrepreneurs that had no kind of protection. I think that if it weren't for civil society organizing itself as it did, the pain would be even greater. That's the first point. Why has civil society organized itself as never had before? We have great inequality in terms of access to education, digital access, financial. Middle class families were drained to great poverty almost overnight. So when we shed light to our inequalities, we have to think and rethink how we can mitigate that. How can we reduce inequalities in Brazil? How can we create opportunities for people wherever they are? These are 2 reflections. On one hand, the role of the state. I am liberal. I always think that the state, the mission of the state is opening pathways, and the private initiative has to come in and take up the space. But it's clear to us that we have to rethink about the role of the state. The state needs to be present in supporting the population in public health. As we've seen now, the state must somehow be efficient to be more effective. Those that do not take care of their accounts cannot take care of their people. We need a modern digital state so that they can care for people in a better way. This brings us to rethink capitalism, almost to be more all-encompassing. I do not know any system of organizing society that has taken more people from poverty than capitalism. Socialism has been like that. All authoritarian dictatorship systems were not like that. Capitalism managed to do that. However, capitalism that we ran in the 20th century generated a lot of inequality too. So I think our mission in the 21st century is how to rethink about this capitalism. How can it be more modern? I think this week, since we are at the public health event, well, I haven't prepared these things, so I'm just being very candid here. Things coming from the bottom of my heart. What we had this week, we had a move in public health that, in my view, were very important. So that points to this capitalism, looking at the 21st century that comes from a man of almost 80 years of age. So it doesn't mean that whether you have a modern or Muslim. Joe Biden this week, the US president, defends publicly the drop of patents of COVID-19 vaccine already developed. This is a very important movement for this capitalism 4.0. Let's defend the pharmaceutical lobby or this or that. This is not what we're talking about. We have a pandemic and we have to solve the problem. It's not profit at any cost. Let's negotiate properly how you can have your investment. How can you have a good business to you? But at some point, this patent has to be public for anyone who can produce the vaccine. So we have to mitigate the problem we are experiencing and its consequences. We need to end the pandemic. We have to resolve it and be prepared for those that may come. Sorry if I've been too long in my answer, but you have to think about things that may not, well, what it may generate is reflection as how we can improve as society and government. I'm totally in agreement with you, Luciano, and your view regarding President Biden's initiative. One thing that we have to separate is that obviously industry, research invests a lot. Of course, they must have their financial return on their investments. That's normal, but we're talking about a situation that is totally out of the normal standard. We're talking about a pandemic in which all countries in the world are suffering a lot. And of course, there must be a solution that is negotiated, but also of social responsibility. It is this capitalism with social responsibility that you're defending. I think everybody shares. I fully share your view. I'm liberal, favorable capitalism, but with social responsibility, it doesn't make any sense. Well, so much so that I think it's silly for us to only want the rich to have vaccines, because the poor will get vaccines, virus start transforming, and the vaccine that was made in Rio will have no effectiveness. It's of public and private interest. It's global and humankind interest that actions like those proposed by President Biden should be discussed, because countries have funded those research studies. Brazil encouraged through a technological commission so that the AstraZeneca would be developed. I assume that all the countries, the US did that with Moderna, Pfizer. They've invested a lot in research and with the risk of throwing the money away if nothing worked. Well, thank goodness it worked. And now it's time for us to rethink the way we conduct that. Congratulations, Luciano. Very good to hear from you. You're going to be president of the Republic, probably with your ideas regarding the country and everything. Luciano, tell me something. Based on this rationale, what kind of suggestions would you give to young entrepreneurs in Brazil so that they can persevere? What in your life as young entrepreneur, when you open the first bar until now to be this world celebrity, I ask you, what would you tell a young entrepreneur? What do you think they may learn from your trajectory and so many other Brazilians that have had successful entrepreneurship trajectories and also failures? What would you suggest?
Very interesting. First of all, thank you for your words. But I think that this has changed greatly. When I began to start businesses and work in businesses in the 80s, any young person with a good college education, with a firm, steady family would get a job in a multinational, spend 30 years working there, dedicating his whole career to a single job, and finally become the CEO of the company. That was the standard. If you wanted to go around and start companies and generate capital, it was very unheard of unless you were already wealthy and established. So I was very young. I was 21 years old, and my father loaned me $4,000, and I paid him back after some time. So I didn't need to go to any banks. But this has changed greatly today. A young person who is creative and who has a good capabilities and skills to execute, they can go and get raise funds for angel capital, venture capital, seed capital, and it's, of course, much harder to start companies if you are in the peripheries and the poor communities, but this is changing now. I always tell my children, if you have creativity, ingenuity, initiative, capacity to execute, if you can make your dreams and your wishes come true, if you put that all together, things will be easier. And I think that the world is changing drastically. I was reading recently that the main technology companies in the US, their employees stay with them for no more than 3 to 4 years. So you see an advanced economy that is looking for solutions to analogical problems that we have. We have so many opportunities in this changing world. Cryptocurrency, self-driving cars, mining in outer space, thinking about artificial intelligence in your smartphone, what we have in these small devices that we are accustomed to since we were born. So imagine what will happen in the next 15 years. So this universe is very powerful, and there's a lot of money. Interest rates are low, even negative in some parts of the world. There is money out there to be invested in new minds and new ideas and businesses. But on the other hand, and I would like to go back to this because I've been talking about this lately, is that we lack leaders. If you consider the new generation, very few of them are becoming politicians. And this ideal of serving others is not very common among this new generation of entrepreneurs. So this new generation that is getting wealthy so fast and early, they need to start thinking about developing leaders. We need to understand, Dr. Vilar, that in an economy like Brazil, this is not good only for our conscience. It's good for the whole country. A continental country like Brazil with 210 million inhabitants. If you see this country as a consumer market, it is an oasis for anyone. So we have the Brazil cost. And if, as long as we don't deal with this, we will not have equality. Only the government can control this, and governments are led by politicians. So we need good capital for politicians who are ethical, who are true, who want to uphold our values and build a country that is better. If we don't do that, it will be no use being wonderful entrepreneurs if we don't have a consumer market that is good and efficient and organized. And therefore, we will be in a horrible situation. And Brazil is so lost. We have conducted this health crisis so poorly that nobody is trusting Brazil anymore. And when you lose trust, you know what happens. You lose credit. Credit is something that takes years, centuries to build and develop, and minutes to lose. So we need to go back to this path. So we are doing well on the entrepreneurial side, but we lack leadership. Political leadership. If you are a good entrepreneur, you have access to credit, to capital, you can carry out your ideas. But we need to think about the other side, the leaders and politics. Very good. And this reflection will even fit into a question I want to ask you. We've been having brilliant minds that are simply fleeing Brazil and going to other countries. They're going to places where they can work better. So you have brilliant people in the northeast of Brazil, in the north, in the center, and going to São Paulo, concentrating these brilliant minds there because that's the only place where we have more opportunities. And also to other countries, such brilliant people who are leaving Brazil so that they can develop their work. So in Brazil, in our healthcare system, in all our areas, we need to have people who are thinkers, who are hard workers, who can work and who can identify the appearance of diseases. Brazil is too big. It is a continent. The diseases that affected my city up in the north, in Rio Grande do Norte state, are totally different from the diseases that affect other regions of Brazil. So we need to have a sanitary surveillance system functioning in real time with the smartphone connectivity to transmit data. So in real time, different has happened in one place, and with AI, we assess that with their algorithms, and then you identify the appearance of something new that we can interfere to avoid this chaos in which we are today. So how do you think we can retain these bright brains here in Brazil? This is a very important discussion, Josier. I participated in an event a few weeks ago with Brazil Conference. It's organized by Brazilian students who study at Harvard and MIT, and it is organized by Brazilians. I watched it, says Dr. Vilar. So I am shocked when I see that most of those students don't even think of returning to Brazil. And this is very sad because we should be able to attract these bright minds. And if we can't attract what we have, it will be difficult to attract anything else. You talked about the different regions in Brazil. The Southeast is the country's wealthiest area. But when you travel around Brazil, and right now I am in the studio where I present my show. And by the way, that's why my connection is so poor, and I'm sorry for that. So being participative in politics is not something that I have as a plan. I don't want to become the president of the country for the sake of it, but I travel around Brazil and I hear a lot of stories. And if you go to any point, you mentioned your city, Caicó. I've been close to your city. There's a honey production plant or farm that I visited. I visited places all over this country. I've seen tons of projects. I see the difference between slums in Rio or in Curitiba. I've seen all that close up. So there's such a big potential here when you can see the wealth of the different regions. The Amazon is such a wealthy region. We should develop it as our Silicon Valley with the potential for biotechnology, the potential in the Northeast with tourism and beaches and the agriculture. You have so much local beauty. You have agribusiness showing that there can be production with sustainability. So I think that the 21st century is showing to Brazil that you can do anything, anywhere in this country. You don't have to jump on a crowded bus and travel to São Paulo and work there alone for years and send money back to your family. No, you can develop your life wherever you're born, with your family, with your roots where they are. And I see this very, very strongly in Brazil. And I believe in that. And I'm not saying that because I want to please anyone. That is what I see, really. You also mentioned something else, which is public health and technology. You included that in your question about attracting talents. Well, a few days ago, I went to a small city in the state of Paraná. It was a really interesting family. They produced jeans, blue jeans at home, and it's a really nice shop, and the whole family was there. And I noticed that the wife of one of the sons who helped the father, owner of the business, had no hair, and she was wearing a scarf, and I noticed that she was doing some kind of chemotherapy. And I can picture this in my mind. And I asked her, "What happened to you?" And she said, "Well, Luciano, my daughter, I had a 9-year-old daughter. There was another little girl there. She began to display some problem in her growing development process. And we went to the public healthcare system because we noticed something was wrong. So we went to the public clinic. And I said, "How long did you have to wait for a doctor's visit?" And she said, "Only 2 days to see a pediatrician." And I said, "Well, that's good." And so we went to this doctor, and she thought there was something strange with the girl, and she asked for some tests. And I asked, "And what happened?" We took 6 months to take the tests. So a child with a hormone development problem cannot wait for 6 months. So I asked them, "Then what do you do?" "Oh, we had to pay for the tests." "How much?" 3,000 reais. So that's more than the whole family earns in a month. They had to pay that for the child's tests. So we took the test and we went back to the same pediatrician. Was that fast? Yes, it was. So she looked at the tests. It could clearly be a sign of cancer somewhere because of that hormone dysfunction the little girl had. And she said that we had to go to the capital city, to a reference hospital. I think it's the Little Prince.
And that's where we went. And when we got there, the exams or the tests were not valid. We had to do tests again. That's why I say, and this is my life, the reality of people's lives, if the Brazilian public health system was digitized, if the clinical record were, networks were really integrated as they should be. I was reading a very good example of public health in Costa Rica, the two examples that I used here, because Costa Rica changed their procedure regarding their environment. It was a country that was very little careful with its environment, and some decades to now, they have redrafted, revitalized their forest today. It's a very powerful country from the standpoint of nature conservation or environmentally, and this is an excellent example of clinical record that Costa Rica has for all its citizens. So, why am I saying this? I think technology, when you combine it with health, when you combine it with education, in Brazil, you have people, the population that is digitized, you have more active chips than you have of citizens in Brazil. And we have a very analog government. Seeing what happened to education during the pandemic, the private school chain, students attending classes, and people from public schools actually working like heroes to provide education to their students. If the government that goes through education management, if the government doesn't really turn into a digital platform, which the relationship with the citizens is open, they feel part of it and owner of that, and they have access to digital technology, the government can no longer govern. So we have to have health tech for the government and for all the areas. This is very important for us to create shortcuts for many of our deficiencies or inefficiencies in the relationship between citizens and the state. This is something that is very important in terms of health. This is key. How can you board technology in the relationship of the citizens with the state in Brazil? If we don't do that, the chance of our having lack of government in the short term is huge. So this reflection is very interesting and totally timely, because if we do not have, Luciano, you've been studying Brazil and listening to public policies and your active participation in the national debate. We have a public health system that is a civilizing accomplishment. Our public health system is what the simplest poor people have in terms of access. The problem of Brazilians is access. How can you ensure access to anything we want to talk about? Education, transportation, decent housing, and health. And this question of access to healthcare, we need to develop the industrial complex in Brazil. It doesn't make sense for us to exclusively depending on imports from India, China, as it happened now during the pandemic, that we didn't even have masks. We had no gloves, no PPEs. So everything was imported, let alone more complex things like multi-parameter monitors and artificial respirators. I'm talking about very simple things that could be resolved and developed in Brazil. In this industrial complex of healthcare that I classify in 4 sub-items: pharmaceutical product industry, inputs, industry, the chain of hospitals, and the fourth of innovation that we need to create in healthcare innovation so that, for example, telehealth can be implemented in an appropriate way. You've mentioned the case of this lady in the interstate area of Paraná state. And I've heard stories of people in the Amazon that are exposed to the sun and have a skin injury, and then the local health agent. We know that we only have dermatologists in 600 Brazilian municipalities. Brazil has 5,000, 6,000 or so municipalities. I can't quite recall the number. We only have a dermatologist in only 600 municipalities. Today, a well-trained health professional with a scope, they can look at that injury and they can actually transmit that so that a dermatologist could say, so this is just nothing, or this is a melanoma that needs to be quickly treated. We have to connect people, and this can only be done through innovation. And thus, to conclude, because I know your time is almost up, you have a meeting right after the hours. I'm not going to exploit your knowledge and your company. And how can we inform the Brazilian business community regarding investing in innovation in healthcare that is of the interest of the public sphere and private sphere? See that the pandemic closed and shut down the trade to defend people's lives so that this is not repeated. It is very important that we have this very well arranged, talked about with the business community, and we're talking about science and technology. And during a pandemic like this, we haven't seen the Ministry of Science and Technology in Brazil taking part of any initiative. It's certainly bizarre. And this is something that happened at this time. So I think we have to call upon everyone. What do you think, Luciano? How would you help to enable this to happen? I think it's interesting to have this reflection of yours, because I'm in favor of free trade. I'm for, as I said in the beginning, the state must be a driver of certain things. The market needs to take care of that. I'm an entrepreneur. I've done this all my life. I believe in the power of Brazilian industry of trade. There's Netflix. I believe in the potential of retail as a whole in Brazil. So I actually have great faith that part of our success, a great part of our success depends on our active civil society, the business community. However, sir, as I said, there are certain things that the state needs to be efficient. We are a country of 210 million inhabitants, and it's not for lack of money. You talk about inputs, masks, vaccines, the poor management in fighting the sanitary crisis we're living in Brazil. Nobody at all ever talked about money. So we had the financial aid, emergency aid. We managed to get the emergency aid. So if we have money to buy vaccines, to buy inputs, masks, respirators, PPEs, this has never been a problem for Brazil. We have a large state. We have major reserves. We're not talking about money. We're talking about inability to manage, lack of planning, vision, and country project. Why do I say that? The state has to take part in certain things. How can you lead a reindustrialization Brazil? The state has to propose this path. How can you facilitate the business environment of entrepreneurs? This goes through structural reforms, the reform of the state, that is decent administrative reform, tax reform. We have to pave the way so that the business community, the industry, the small, medium, large-sized entrepreneur can actually and actively participate in society. But there are certain things that are up to the state. Public health is a state issue. The public health system is the most democratic system and accessible on the planet. It needs to gain efficiency and quality. Yes, the work has been done. It's just a matter of proving it. Public education, it's the duty of the state. When you talk about research, research has to be driven by the state. Public universities worldwide are the major science developers. See what happened to Brazil with Embrapa in the 1980s, with heavy state investment to develop new molecules, and research studied in Brazil was unique in the world, a tropical country and very productive. So we're reaping the fruits of the seeds sown by Embrapa in the 1980s. So today we produce food to feed 1 billion people worldwide, and people are starving in Brazil. It's a huge imbalance. We could produce for 3 billion in Brazil if we could. Of the 15% of the agricultural landowners produce over 80% of our production. If you can get productivity another 35, you triple the production. Why do I put that? Science. Well, that has high cost, 22 million reais. So I was talking to a friend that has an institute, Josier. The budget of the institute that invests in science is higher than the fostering agency of the government, CNPq. So it's priority, and a country that does not invest in science does not invest in the future. I believe that science is the great driver, has to be the stage where universities, and then you take the private universities, there's very little investment in science and research. So yes, I believe we have to invest in science a lot. I do not think that this is a responsibility of the business community. It's the responsibility of the state, and the business community can support, can take part, can be close, can use the technology, use it in real life. But as I said, regarding education and healthcare, this has to be a priority of the state. Perfect. And this has been the priority that China, the United States, Korea, and so many other countries have given to innovation, to research and technology. And we have discouraged science in the past times, and this is very bad for Brazil. My dear Luciano Huck, I have no words of thanks to you. Well, our event has been wonderful. We gathered over 15,000 people over these past 4 days to discuss innovation in healthcare. It's been an honor to us to welcome you, to have you at this closing session with the golden key. You go into our home with a kindness and lightness and respecting all of us, and you end up being a very close friend of ours, even though we have never met personally. I'd like to embrace you, to you, Angelica, your children, because you're part of our family. Stay safe, healthy, and let us be always together in this fight for a healthier Brazil with fewer pharmacies and more education. Great hug to you, my dear Luciano, and congratulations to all of you who have been with us. Thank you, Josier, for the invitation, for everyone that has been with us. So also willing to discuss problem solutions. It's always good to start thinking and see if the ideas are in order and making sense. So thank you all very much. Those of you who have attended, thank you to Dr. Margaret Delcomo, who has connected us. When you want to discuss public health, you can call me, because I'm very grateful to all healthcare professionals, to the industry, pharmaceutical industry, and all of those who have not let us down and alone amidst the pandemic. So thank you all very much. Yes, thank you very much for your words.